Good afternoon. Thank you for joining me on this Monday for an update on our COVID-19 response. I just want to take a moment and thank the churches that held virtual services over the weekend. I appreciate that. That's practicing and honoring social distancing. My family and I, we put a TV on in the backyard and watched our church through the virtual service. So again, thank you for providing that. And I encourage you to continue to do that as we work our way through this. With me on the call today are Sheriff Mike Williams, Fire Chief Keith Powers, and EOC Director Steve Woodard that can take questions as we conclude this briefing. 1 month ago, on March 13th, my state of emergency declaration for Duval County took effect. There have been long days, tough decisions, hard times for many people since then, but together we're getting through this. I'm proud of the steps we've taken and how the community has acted in response to this virus that is a ghost. So I want to say thank you to the people of Jacksonville. Recently, I signed a new proclamation that extends the state of emergency for another 30 days. As of this morning, the Florida Department of Health is reporting 692 positive cases in Duval County, 62 hospitalizations, and 13 deaths. Our percentage of positive tests is 5.5%, which continues to trend below other major metropolitan areas in the state. To the families that are dealing with this, to the families of the 13 people that have perished as a result of this disease, can't imagine what you're going through. Loved ones having to die alone. Our heart and prayers go out to you. I know many people are antsy and want to get back to work to get their lives back to normal. I'm there, believe me. I want to get back to normal. While data suggests we're doing better than neighboring communities, we are still in the midst of a very real public health crisis. In fact, we've seen a slight increase in the last week in the number of suspected COVID-19 transports from Jacksonville Fire and Rescue Department. So we must remain focused and vigilant. I want to remind folks, models are not predicting the peak for another week or week and a half, so we still have work to do. That's why our local and state orders remain in place to continue our efforts to reduce the spread of the virus. Social distancing is so important. I need you, and by the way, I commend the people of our city. I see people practicing it, but I do at times when I'm getting supplies, see people clustered in areas, groups of 5, 6, 7, 8, 9, and maybe in a grocery store in very close proximity to each other. The very real action to stop the spread of this is to keep our distance. So just be very aware of it and discipline of it and take it very seriously. Of course, first responders continue their work on calls unrelated to COVID-19. The data related to those cases also show impacts of this virus. For example, with fewer motor vehicles on the highway, we've seen substantial reductions in calls related to motor vehicle accidents. We're also seeing reductions in calls for chest pains and symptoms for heart attacks. Some of that reduction appears to be caused by the fear of going to emergency facilities. If you're having these issues, please contact your healthcare providers and contact emergency assistance. Our first responders are taking every precaution with practices and equipment to guard against the spread of infection. The demands of our first responders also include high levels of violent crime. We've demonstrated the capacity to come together and help one another so well in a response to COVID-19 over the last number of weeks. In the weeks, months, and years ahead, we must do the same in response to these violent acts by working together to protect each other. Throughout this crisis, we must also be mindful of those who are struggling with alcohol, addiction, drug abuse, depression, and thoughts of suicide. Our fire chief recently shared with me that the number of drug overdose related transports is higher than it has ever been. There are many out there struggling, and if you know someone who has struggled with these issues in the past, please consider picking up the phone and checking in with them and let them know you care and you're willing to help them connect in a way that's meaningful. To those in need, we have a list of mental health and other resources posted on the city's website at coj.net/recovery resources. And for anyone who's struggling with thoughts of suicide, please call the National Suicide Prevention Lifeline at 1-800-273-8255. It's a hard road ahead to get out of this worldwide disease that is COVID-19. Locally, we may have flattened the curve. We may have extended the peak with a lower caseload so our hospitals aren't overwhelmed, but we just don't know yet. Suspected COVID-19 patients are still arriving at a rate that we must watch as test results come in. No local municipality can save this economy. This is a worldwide pandemic. Opening our city while others continue to suffer would be irresponsible and dangerous to our citizens, healthcare responders, healthcare workers, and first responders. Hospitalizations that are happening today are likely for those who were infected by the virus weeks ago. Recently, the president announced his task force on restarting the economy. My team and I are monitoring that and are already thinking about what we need to do at the local level to get this city moving again when it's the right time. Over the weekend, the state of Florida took over operations at Lot J testing site. I'm grateful for Governor Ron DeSantis and his team for stepping in to make sure we can maintain this critical resource for our community. We've increased the number of tests per day there to 400, and last Friday, the governor announced the expansion of criteria to include asymptomatic people who've been in close contact with individuals who've tested positive for COVID-19. This site is also open for individuals with respiratory symptoms and first responders or healthcare workers who've had direct contact with patients. In addition, results are coming back faster. If you test positive, you'll be notified first and should have results in 3 to 5 days. Results for negative tests may take an extra couple of days. Starting today, nearly 60 members of the National Guard reported for duty at Lot J to allow our first responders at Jacksonville Fire and Rescue to return to their normal duties. Testing continues at our site at the Prime Osborne with Baptist and Telescope Health. The U.S. Surgeon General is reporting that people of color are being hit particularly hard by this pandemic. I want to thank UF Health for stepping up to provide testing in some of our high needs communities to help. I want to provide a brief update on our firefighters who've been diagnosed with COVID-19. Currently, 3 firefighters from the same station have tested positive for COVID-19 and 77 are under self-isolation. When we get to questions, Chief Powers will be able to provide more information. We're continuing to see reports of well-meaning groups and organizations holding drive-through events to help neighbors in need. I appreciate the compassion and concern. However, I must remind those groups that are contemplating events to take care of those who are in need or in the workplace. These events must adhere to the guidance of our emergency orders. The virus is spread by our actions. It doesn't spread itself. So we must act responsibly, practice social distancing, and follow CDC guidelines. Our social services team has been working on plans to safely provide these services to our neighbors. We will announce more information about this in the coming days. Over the weekend, while on supply runs with my family, I saw many people wearing masks and face coverings in stores. Thank you for that. Wearing a mask or cloth face covering can significantly reduce the chances of individuals spreading the virus from the droplets and coughs, sneezes, or other actions. I encourage everyone to wear a mask when they're out in public spaces, getting supplies, and in times when they're not able to practice social distancing, like grocery store checkouts or convenience stores. Expect to be wearing masks for a period of time, potentially even when we come out of this. So we act and behave responsibly. Anybody that's not taking social distancing seriously at this point, it's a mistake. And you're putting your neighbors and your friends at risk. So please practice social distancing, make a mask, and wear it. Before I close, I want to thank everyone who shared their stories with me about the nightly 7 p.m. calls they make. I have been so touched by the calls I've made and incredibly touched by the people that have surprised me and called me. So know that when you make that call, you're having an impact on someone's life. So make that call tonight at 7 p.m. Listen to someone and share with them. Thank you again, and now we'll take questions. Bridget with Action News.
For the, can you hear me okay?
I can.
Okay. I have a couple questions for the fire chief. Is there any relation between any of the people that tested positive at the news station in relation to the firefighter that tested positive last week? We're hearing that it was a wife and husband, and the husband came to work after that first firefighter tested positive. And then can you give us a breakdown of drug overdose numbers? You say they're higher than they've ever been. Do we have those solid numbers? And numbers for the coronavirus transports as well?
Hey,
Chief, I'll let you take that question.
Okay, thank you. Thank you, Mr. Mayor. Good afternoon, Bridget. As it relates to the firefighters, so as soon as we found out about the firefighter testing positive at Station 28, we pulled down all of the firefighters on all 3 shifts at Station 28. We had all of those firefighters tested. Over the weekend, we received some of those test results back, had a second person test positive, and then the third person. The third person had worked at 1 shift at Station 54 on the south side as well. So we had to remove people from that fire station just out of an abundance of caution to make sure they weren't exposed or exposing anybody that we respond to. As it relates to the overdose question you asked, JFRD responded to 436 overdoses in the month of March 2020. That's a 20% increase from February. So our concern is, and what we relayed to the mayor is that people, their doctor's offices are closed, their pain management clinics are closed, and then they're turning to street drugs to supplement, their pain medications. And so I'm just asking people to please don't do that. Call your private physician. If they can't help you, then you can always go to gatewaycommunity.com or call 877-389-9966. And they can help you with, if you're having a problem obtaining your medications, they can help you with some treatment.
Ann, First Coast News.
Good morning, Mayor. I had a couple of questions. Stand by, I just lost them. So 2 questions, actually. One is hospital staffing. I had asked you last week how many hospital workers are sidelined by the coronavirus, and I'm wondering if you know the answer to that. Also, the health department has declined to identify which senior care facilities have coronavirus outbreaks. And I'm wondering if you know which ones in our area do have large numbers of cases, and if that's something the health department shares with you.
Director Woodard, I'll let you take those questions, please.
Yes, as it relates to hospital staffing, we do not have any specific numbers. We understand that they do have the capacity and capability to meet any staffing needs they have at this time. As far as the facilities that are impacted in the community, we have been tracking a lot of that information since this began. We do work closely with the health department. The state has some incident management teams and some assets that are also dedicated to checking on each facility in the community. They do in general share that information with us, but what I can tell you now is that at this time, other than the initial facilities where we saw some clusters, we are not seeing any unique activity that would classify as clusters in any other facilities in Duval County. Thank you.
Courtney with Action News.
Right. Good afternoon, Mayor. A few questions for you just regarding Lot J testing. So first thing, how long will National Guard presence be there? And also, Lot J, I know you talked about testing and the time frame. Will Lot J see the rapid tests that we've been hearing about and reporting about? And also, the governor mentioned the FDA-approved antibody testing. Will Lot J see those as well?
Well, first, Lot J now will be run by the state, thanks to Governor DeSantis and the National Guard, and we'll be working with their tests. It's my understanding at this point there's no plan to change the way those tests are being administered there. And Director Woodard, our Chief Powers, if you have any additional insight on the antibody tests, you may want to add.
Chief Powers.
Yeah, I'm not aware of anything that has been approved by the federal government yet. Once that's done, we'll work through the state and see where they want to go with instituting that form of testing.
Scott Johnson, News4JAX.
Yes, Mr. Mayor, I have 3 questions, 2 for the mayor and 1 for the sheriff. I'll start with the sheriff. Sheriff, we've seen a lot of violent crime this weekend and the past week with the shooting death of the little girl and then 2 police-involved shootings over the weekend. Are there targeted patrols going on? Can you speak to the status of crime fighting right now with the spike in violent crime we've seen?
Yeah, thanks, Scott. So short answer to that is yes. Obviously, when we have hot spots, we're able to reallocate some resources and direct them at those hot spots. And we saw that this weekend. We actually had some task force operations going on this weekend, arrested 26 felons, took 6 guns off the street. So that's the kind of activity that, that generates when we target these areas based on data, where we know this activity is occurring, and we do that. I want to take a minute and thank that investigative team and a lot of other people at JSO, as well as FDLE and the U.S. Marshals for their help in the Kiera Addison case. I mean, that was a huge effort over 3 days to get all of those people off the street and in custody, and to be able to provide some measure of justice in that case. There's a lot of work left to do. But again, my hat's off to them with everything else going on, to focus on that, obviously, and bring that case to such a swift conclusion on our part. And then just an update, Officer Meschling is doing, also that was stabbed on Saturday, is doing better. She'll come back to work after administrative leave. And, she obviously has gotten a lot of well wishes, but she is doing well. So we want to thank the community for that as well.
Mr. Mayor, can you hear me?
I can.
2 quick questions for you. 1, Governor has taken the time with the month off for society, really, to improve I-4 and get construction done. Is Jacksonville following suit and getting any vital projects completed with this time where people are not on the roads? Also, can you speak to how the economy is doing in Jacksonville? It's taken a hit nationally. How is Jacksonville's economy doing right now?
We are continuing with infrastructure projects that had been planned. So our CIP, if you will, infrastructure work moves forward. We will be considering, by the way, as we talk about the economy, as we come out of this, looking at infrastructure needs that we've had over a number of years and trying to figure out how we can expedite those. A, it's work that's got to be done. B, it will be good for jobs, people, and the economy. As we think about the economy and the President Trump has got his task force that he's announced to get the country back to work. When they arrive at that point, we are locally and internally thinking about what kind of things can we do that will help incent people, businesses to go back to work and create jobs. The other thing we're thinking about, though, is what's going to be our part in testing, the ability to test people rapidly, the ability to, if they test positive, to ensure that they're isolating, and also to ensure that people understand that when we go back to work, we're probably going to be needing to wear masks for a period of time to err on the safe side. So I encourage municipalities, yes, we're going to need the federal government and the state government in terms of testing and a national plan to go back to work, but local municipalities should take some responsibility. That's what we're doing. I'm going to encourage large companies in town, when we get more information and data, to consider maybe implementing their own testing so people can quickly be identified on the other side of this and isolated so we don't end up back in a complete shutdown. Ellen with the Jacksonville Business Journal.
Hi, yes, thank you, Mayor. I was just curious if you could provide an update for us on how the small business relief program with ViStar is going, and also any plans you have for if and when you reach that $50 million lending cap.
The feedback I'm getting so far on the partnership with ViStar is positive. People are applying, they're working. ViStar is turning applications around rapidly to deploy funds like they said they would. We will have to revisit. Look, if every day we're evaluating orders, have we done enough? Should we do more? And in terms of how we stimulate the economy, what does that look like when we come out of this? We will be announcing other incentives, if you will. I don't know what those look like yet, whether they're cash or not, but we are evaluating every single process the city of Jacksonville has that touches private companies to make sure we can do everything we can to help them get back to work. And look, the reality of it is the entire country is shut down for public safety reasons, for public health reasons. But it's shut down because governments ordered shutdowns. They had to. But that is to say that governments created this financial burden on people because of COVID-19. They had to do it. It's the responsibility of governments now to do everything that they can, everything that we can locally to play our part to get people back to work at the right time. Troy with First Coast News.
Thank you, Mayor. One question for you, and then I'll have another question for the sheriff. With the spike in violence through March and with the number of homicides at this point where we are today, are you concerned about how COVID-19 is impacting your efforts to curb violence in the city? I know Cure Violence had mentioned that they were experiencing some issues meeting people to stop some of the issues that are going on. And my other question for the sheriff would be, of those arrests that were made, how many were of recent suspects in any of the recent homicides in the city?
Yeah, of course, I am absolutely concerned. Cure Violence, obviously with social distancing, that impacts the ability to get out into the community and mitigate a retaliation from one violent act to the next. The Kids Hope Alliance, which provides spaces for young people and summer jobs and year-round jobs, learning opportunities, all those things are prevention and intervention related to help young people make good decisions and not end up in a space or a life of violent crime. And without people being able to physically be together right now, yeah, I'm concerned. And we're just going to all have to work to do our part to get through this. And as I said in my remarks, the community at large has really pulled together to battle COVID-19, to play their role. And while the sheriff and I have talked for years about many of these violent crimes are contained amongst small groups of people that historically do bad things. And then there are times where we have tragedies where a child or an innocent person gets caught in the crossfire, terrible moments. But the message to the community is just because these are small groups of people largely fighting amongst themselves, we can't ignore it as a community. And I hope that we can come out of this and all agree that we've got to be in that fight as well together. Sheriff?
Yeah, thanks, Mayor. So, and that's stated perfectly. I think to answer your question, the 26 felons that we arrested in those task force operations were not related to the homicide cases, but we have had a really successful run in making arrests in those cases. And again, obviously, you guys know we're posting that on our data share site that you can go and look at that. So, but to the mayor's point, he's exactly right. I mean, what we're seeing is really an increase in what we've always seen. It's not new violence. It's nothing that really, in terms of, us wondering what's happening. It's the same group of people conducting the same type of violence amongst each other. And so again, that's ground zero for us, and that's where we've got to, get in there every day and intervene in that, where we can. We have seen a spike in domestic issues, and that is probably something you can directly relate to quarantine. We've seen a couple of mental health issues obviously pop up. Again, something that obviously quarantine is driving some of those people to deteriorate. So, it's not one answer, it's not one thing, and we're juggling all of these issues. But at the end of the day, we're getting a lot of support from the community. We've got an energetic workforce that is really dialed in and focused on working every day. Morale's high. We've got the resources to do this work. We're spread thin and we're very busy, but I'm proud of the men and women of JSO. They're doing a terrific job. So, and we'll keep working every day to keep this community safe.
Bridget with Action News.
I have just two more questions, one for the sheriff and one for the fire chief. Chief Powers, how are those firefighters doing, the ones that have been diagnosed with coronavirus? Are they having any complications, or are they, expected to be just fine? And then for the sheriff, you've touched on some numbers in the past couple weeks, spike in crime. I did ask your PIO if any crime numbers have gone down, and they said, no, it doesn't look like we're seeing any decline in crime. Do you have definitive numbers that you could get to us, just showing us the crime spike in the different crime categories?
So I'll go first. The answer to that is yes. So you do have some overall crime issues. Remember, there's a lot of buckets, obviously, that we're counting these numbers in. Burglaries are down, as you can imagine. A lot of property crime is down because everybody's home. So you see that kind of decrease. And again, we track this every single day. So we can get you some snapshots of overview for, this particular day as it compares to the same time last year. We'll share some of that with you.
Bridget, as it relates to the firefighters who have tested positive, one of them is on the road to recovery, doing a lot better. One of them is one of the kinds of, the tests that show that they're, the person's asymptomatic. It's what the mayor and the governor talked about in their press conference the other day. And the last person is still struggling, having some pretty difficult times right now.
Courtney with Action News.
Yes, Mayor Curry, can you tell me how long the National Guard presence is expected to be at Lot J, and kind of just expand for us, expand on their role for people who aren't quite clear?
Previously we had Jacksonville Fire and Rescue folks and JSO officers out there, helping process the tests. They're stepping in, so our fire and rescue folks, public safety workers, can get back to some of the stuff they do on a day-to-day basis. I don't have a timeline. What I can tell you is, though, the feds were going to be wrapping up this past weekend. The governor offered to step in and keep the testing going. So we evaluate this stuff day to day. As long as we're in the middle of this, while we're looking to come to the peak, our hospitals are looking to come to the peak. I'm going to do everything I can to fight and make sure we keep that site here until we need it. We don't know when that is, but as long as we need it, I'm going to work with the governor to make sure we have it. Last question, Scott with News for Jax.
Yes, Mr. Mayor, you mentioned that the virus tends to be hitting hard on communities of color, peoples of color. And saying that UF Health is trying to help out. Is this a national trend, or have we seen this locally where neighborhoods with higher populations of minority neighborhoods are seeing issues with the virus? And why did UF Health need to step in? Why was that so critical?
I don't have the data from the hospitals in terms of patients, in terms of age, backgrounds. I don't have any of that data. I'll certainly ask as you've asked that question. But I saw the Surgeon General speaking last week, and this appears to be a national thing. And UF Health last week, I was on a phone call with the governor's team and members of the University of Florida. I don't remember, late one night last week about this. UF Health wanted to set it up, and we think it's great. We're grateful that that they're testing. And as we get testing and results, we'll have more information on impacts locally. I'll close with this. Every action that this government has taken, every executive order has not been taken lightly. Anytime we put out orders that we know are going to impact lives, provide economic hardship, social hardship, in the interest of public health, they're tough decisions, but they're decisions that had to be made. They're decisions that had to be made to protect all of the people of this city, to protect our health systems. And if we just keep practicing social distancing, wearing masks, washing our hands, if you cough or sneeze, do it into your arm. We'll get through this. And so keep it up, Jacksonville, and thank you.